Hey, future nurses! I'm Nia, your nursing tutor, and today we're comparing diabetic ketoacidosis, or DKA, with hyperosmolar hyperglycemic state, also known as HHS. These are two of the most commonly confused diabetic emergencies in nursing school and on the NCLEX. But by the end of this lesson, you'll know exactly how to tell them apart. Both DKA and HHS are life-threatening hyperglycemic emergencies. However, they affect different patient populations and have different underlying mechanisms. DKA most commonly occurs in type 1 diabetes and involves ketoacidosis. HHS usually occurs in type 2 diabetes and is characterized by severe dehydration without significant ketone production. Both conditions may be triggered by infection, illness, missed medications, surgery, or significant physical stress. DKA often develops after missed insulin doses or a new diagnosis of type 1 diabetes. HHS is more common in older adults with type 2 diabetes who become severely dehydrated. Young type 1 patient, think DKA. Older type 2 patient, think HHS. Here's the biggest difference. In DKA, there isn't enough insulin. The body breaks down fat for energy, producing ketones that cause metabolic acidosis. In HHS, there is still enough insulin to prevent fat breakdown, so ketones usually don't form. Instead, extremely high blood glucose causes osmotic diuresis, leading to profound dehydration and a hyperosmolar state. Let's compare the clinical presentation. Patients with DKA often have Kussmaul respirations, fruity smelling breath, abdominal pain, nausea, vomiting, dehydration, and blood glucose levels typically above 250. HHS patients usually have blood glucose levels greater than 600, profound dehydration, confusion, and altered mental status. They generally do not have fruity breath or Kussmaul respirations. If left untreated, both conditions can lead to shock, coma, and death. DKA complications are largely related to metabolic acidosis. HHS complications are primarily caused by profound dehydration and hyperosmolarity. Treatment for both conditions begins with aggressive intravenous fluids. Insulin therapy is used in both DKA and HHS. Electrolytes, especially potassium, must be monitored carefully. In HHS, fluid replacement is often the highest initial priority because dehydration is usually much more severe. NCLEX question. A 72-year-old patient with type 2 diabetes presents with a blood glucose of 850, severe dehydration, confusion, and no ketones. Which condition is most likely occurring? A. DKA, B. SIADH, C. HHS, D. Diabetes insipidus. The correct answer is C, HHS. Remember, older patient, type 2 diabetes, glucose over 600, severe dehydration, and no ketones strongly point to hyperosmolar hyperglycemic state. Thanks for studying with me today, future nurses. If this comparison helped, save this video because DKA and HHS are frequently tested in nursing school and on the NCLEX. I'll see you in the next lesson.